Welcome back. Time now for Real Men Wear Gowns, our campaign to get guys to pay attention to our health. Make the appointment, put the gown on, get screened, be proactive. One of the most serious but sometimes overlooked issues is lung cancer. And joining us now is Dr. Maish, a thoracic surgeon with Franciscan Health. Thank you so much for being here.
Thanks for having me.
So lung cancer has long been associated with smoking, right? We've seen smoking rates kind of go down, but lung cancer is still an issue, particularly with men. What are you seeing?
Yes, unfortunately, men have earlier access to cigarettes, so commonly they start smoking younger. We also see that they smoke heavier. That might be some of the demands that they are thwarting off in society. And also, since they're the breadwinners in the family, they often have more funds to be able to fund the habit. So we do see a higher proportion of lung cancer in men as a result, although women fall not too far behind in this day and age. It's kind of evening out over the last 2 or 3 decades.
Are we seeing lung cancer rates going down or up or about the same historically?
Yeah, the lung cancer rates are actually still about the same, unfortunately. I think that while there are other substances kind of coming into play and taking away some of the heavy smoking that we've seen in the past, we still see fairly high rates of lung cancer. What
are some of the early warning signs that we should be watching for?
Unfortunately, lung cancer can get pretty far advanced before we actually have any symptoms. Kind of common early signs people would notice, for instance, that perhaps even though they've been able to actively participate in sports or maybe keep up with their kids or their colleagues, now they're just noticing that they're a notch behind, even at the same rank and file, so to speak. So most people will notice maybe a little bit of a cough, sometimes feeling fatigued. As things get more advanced, even chest pain or sometimes even coughing up some blood. But the early stages are fairly uncommon to have many symptoms at all.
And those symptoms, if you have symptoms, are often overlooked, I would imagine, or ignored or written off as something else, right?
They are often, if somebody goes to their primary care physician and says, oh, I have this little cough, of course they're going to go down the pipeline of ruling out a lot of other much more common scenarios. So people can get fairly advanced along that pathway in lung cancer before something is done.
So I would imagine, and I've heard a lot about screening recently, that would have to be a great idea.
I think that screening in lung cancer, fortunately, is very easy to do. It doesn't require, drinking a lot of substances to clean yourself out. It doesn't even require any anesthetic. Just going for a CAT scan, which is just a simple test, no IV, nothing. You just lie on a table, you go through this short little tunnel, and then you come out with results. Anybody who's smoking now has access or has smoking history will have access to a lung cancer screening program. This will be paid for by insurance, actually. So we really encourage people to get out and get themselves screened. Early detection of lung cancer is really the key, just like any other cancer, and really fairly well tolerated for treatment. So we really encourage people to get out and get those low-dose cancer screening done.
What about prevention? Obviously not smoking, but is there anything else that we should be doing?
I think the 2 key things for prevention are, one, if you have a family history, getting that scan early would be really important. If you have a smoking history or are actively smoking, that would be the next best thing, because if you know that you don't have it, now you can do things to try to prevent it. Other than that, just keeping your lungs healthy in general by not inhaling any toxic substances, and maybe checking your environment, to make sure that you're optimizing things in your home or even in just around in your environment, your workplace.
Radon in basements, for example.
Yeah, we don't have a direct link to lung cancer with radon, but it kind of deteriorates everything, in general.
Gotcha. There's a lot of fear around lung cancer, and long has been, but there are advances in treatment as of late.
Yes, there are lots of advancements in lung cancer. Fortunately, early detection being one. We also, in the surgical arena, we have now many different ways to approach the surgery for lung cancer. So in the old days, actually not so long ago, we used to have to make fairly big incisions to get into the chest and break ribs, and it was very morbid. People came out with a lot of pain, and also it would take quite a bit of time for people to recover from that surgery. But now we can use small little instruments about the size of my pinky fingers and we go in and we detach the lung from the structures that it's attached to. Once we detach that portion of the lung, we're able to then pull that lung out without destroying a lot of the tissue around it. We rarely have to break any ribs. Very uncommon to actually have to open up anybody anymore to remove lung cancer, especially in the early stages. So that's one arena where we've made a lot of advances. Also, the oncology side of things, we now have access to immunotherapy, which is much better tolerated form. It's a type of chemotherapy, but is very well tolerated, doesn't have all the side effects that people commonly associate with chemotherapy. And even radiation therapy has had a lot of advances. While at one time we used to have to give quite large doses of radiation over a very broad field, now they're able to cone down into something very specific and really beam right at the problem area and kind of spare the healthy tissue around it. So we have a lot of things in lung cancer specifically that have allowed people to get treatment without a lot of side effects.
Finally, doctor, what's your message to men in particular as it relates to lung cancer?
I think that men tend to not want to talk about the things that are going on in their bodies. They're all sort of withdrawn, thinking that it's not very manly to be sick. It's very important to talk about that, especially with your physician, but even with your spouse or your friends when you're not feeling well. And also just being proactive about your own health as opposed to waiting for your wife to kind of nudge you to become proactive about it. And then once you do know that you have something that's going on like lung cancer, seek out good treatment with people that can understand how you're feeling and make sure that you can carry it out to the end.
Okay, Dr. Maish with Franciscan Health, thank you so much for being here.
Thank you. Thanks for having me. Appreciate it.